Hello and welcome to this special edition of ATS News brought to you by AboveTopSecret.com. I'm Mark Allen and we're here today in Detroit, Michigan, speaking with the one and only Dr. Christopher Kit Green. Dr. Green is not only a medical doctor, but he holds a PhD in neuroscience, and he's also a fellow at the American Academy of Forensic Sciences. We're here today to talk about our concerns relative to the swine flu with Dr. Green today. Dr. Green, how are you?
I'm fine, Mark. I'm glad that you came here to the Detroit Medical Center. It's convenient for me, and I know that the subject that you just posed that we want to chat about is something that, from different perspectives, we've been very interested in for a long time. In my case, I was interested in it back in 1969. At that time, I was managing the Biological and Chemical Analysis Division of the Central Intelligence Agency. And one of the things from then until I left government service in 1985 that was always high on our list was how one should approach trying to decide in a case of emergent diseases in general, infectious diseases specifically, and the flus in most particular. We could tell what was really going on because the data is difficult to get, and as we now know, as what's happened in the last several years, it's confusing almost beyond belief. And I think I have some ideas about why that's the case. I'm glad to talk about them. I should make it clear I'm not an epidemiologist. I'm not an infectious disease physician. I'm not an internist. I do neuroradiology and brain imaging. My area of responsibility is associated with trying to, as a forensic medical neurologist, decide how to approach when people get sick and it's not clear why they're sick, what's causing it. And if it happens that they should die, to try to find out what the cause and manner of death is. That's what a forensic scientist does, and that's what I've done ever since 1969. Try to understand when there's emergent problems in medicine, what is it that's really the problem area that needs to be investigated. In this case, I'm still interested, but from a different perspective. I'm no longer associated directly with analyzing intelligence data, but I am indirectly because I chair a number of committees in the Department of Defense and in the intelligence community that are associated with biological and medical issues, wide-ranging. And some of those issues are related to things like emergent diseases. So I'm still interested. As a practicing physician here in Detroit, I'm lucky with that interest because we have here in Detroit and in the Detroit Medical Center the world's largest urban accumulation of not only hospitals but of potential patients in an urban environment, the largest medical school in the world, the largest number of physicians in any set of 11 hospitals associated with what we're doing. And one of the responsibilities I have for the community is to serve on the local emergency preparedness committee for Southeast Michigan. And that committee and my interest there is very, very interested in what's really going on with the vaccination program, what's going on with people getting sick with the flu, trying to decide what kind of flu, trying to decide what the effects of the vaccination programs may be. So actually, although I'm no longer either in the military or the intelligence community, I'm still analyzing the same problems, the same issues. And that gets to where I think you and your membership, and certainly what I've seen when I've looked at the site, are the most interested in. And let's just really nail it at the moment. The real issue is that of conspiracy and the extent to which, if at all, there are conspiracies that are associated with these issues that need to be addressed publicly. My personal position is, yes, if there are conspiracies that are associated with government actions or state actor actions or actions that are not good for people, they need to be exposed, they need to be discussed. And I can tell you that this issue is one of the most confusing that I've ever looked at. It's certainly more confusing than anything we addressed back in the late 60s, the 70s, and the 80s, where we were looking at vaccine programs and biological and chemical programs from the former Soviet Union, for example. Therein lies part of the problem. When the wall came down, within a matter of months, and actually certainly before a year or 18 months was over, the United States government's military and civilian intelligence apparatus to do scientific investigation of medical and life science and many other forms of engineering threat went away. Our government, in its wisdom, since there was no longer an enemy, and all of our actions and activities had been so carefully focused on what was the former Soviet Union and the threat against the security of the United States, it was deemed that those resources could and should, and in fact they were moved. And so while back in the 80s, we had thousands of analysts across the United States government looking at intelligence data that may relate to national security threats for technology and national security threats in particular for life science issues. Today, those analysts could be measured in numbers of dozens, probably the low number of dozens. The reservoir of trying to do intelligence analysis has largely become a real challenge. And the good news is that it is now handled in the private sector where it should be, and it's being handled as well as it can. But nonetheless, when you get an intractable problem, like what is the reason why the flu mutated, why was it that it reemerged in 1977 after having been dormant for many years, apparently disappeared since 1957. What caused that? Well, we now know that it was caused because of a release, still unidentified, from a laboratory. And in fact, the issues that relate to the medicine are frequently misinterpreted by the public and by myself and many others when we don't keep track of the density of the data. For example, what I just said has been clearly labeled, clearly understood, clearly articulated, very well in the medical community known since a publication by two wonderful scientists, two physicians at Pittsburgh, Zimmer and Burke, in July of this last year, in arguably one of the finest medical journals in, if not the best, medical journal, the world, the New England Journal of Medicine. Their article explicated in detail for anybody that's interested the entire history of the swine flu, the way in which it went to humans, the way the birds, the swine, and the human reassortments occurred. There were actually 8 or 9 or 10 reassortments that occurred in a period of 30 to 40 years. It's now very well known what they are. It's very well known why they occurred. There are some inexplicable things, and I imagine we'll talk about some of them today. One of them is, why did it emerge all of a sudden after the so-called herd immunity from all the vaccinations which had occurred had apparently caused it to go away? And by the way, what do we know about those vaccination programs that occurred in 1976? Well, we know a couple things. We know that they stopped it, they controlled it, and that was really good. We also know that there were 532 cases of Guillain-Barré disease, which plagues us today. No pun intended on that word, please. But which we now know is, fortunately, at a much lower rate with the current vaccination programs of all kinds, but still something that caught us up short and scared the dickens out of the medical community. Sure, we got rid of a lot of flu and a lot of people vaccinated, over 10 million, 20 million, but nonetheless, there were still deaths that were very, very important that cause problems today in the conspiracy business. And they should, until those are well understood. Now, I'm sorry for that rambling introduction, but I guess what I really wanted to say was, first of all, The physicians who are working this issue are also confused about a lot of things. We also don't have the data that we should. The data that we should have can only come from the physicians and the epidemiologists that are working the actual streets, literally. And I'll mention an issue concerning that in a minute. There are no additional sets of thousands of physicians working for the United States government to sort these questions out. They don't exist anymore. And so some of these questions are going to be around for a long time.
Wow. AboveTopSecret.com is the largest conspiracy theory discussion board on the internet. Our membership is going to be very concerned and very interested in the fact that you just openly admitted, which is well-known history, that you are in fact on several DoD intelligence boards. You did serve in the CIA. You have been affiliated with the government. And in some respects, and there's a lot of innuendo and not very well written or very well thought out rumor mills on the internet about your history. So my first question is, why should the membership of AboveTopSecret.com listen to you? And more importantly, why should they trust what you have to say about it?
Well, I'm grateful for the question. I think it's a fair question. And I'll give you a short answer, and then I'm going to give you a somewhat longer answer, but I hope only somewhat. If somebody is so conspiratorial, and in my business I know there are people that are so conspiratorial, and that's fine, as to believe that anybody with my background as an officer in the federal government who currently sits on a lot of boards, including the one I mentioned or you mentioned earlier, which is the Local Emergency Preparedness Committee for the state of Michigan, looking at these problems. If a person by definition who's doing that professionally with a professional background to understand the concerns about emergent diseases is not believed because they come from the government, then that person should not believe anything that I say. And I would understand if a person is so conspiratorial that they wouldn't. And I would be sad about that, but I'd forgive them. The slightly longer answer is that it doesn't make any difference whether somebody believes me or not on this issue, because everything that I have said and everything that I will say is public. It's just kind of tough to get to, and I hope that what I can do, which might even help some of the people who are conspiratorial and think anybody like someone with my background's a bad guy, would still be able to say, well, okay, he's a bad guy, but at least he did tell us where to go get the data. And I can do that. And for example, let me just tell you what I did in the last several days. I do this all the time, but I really went to trouble with doing this in the last several days. I talked to about 8 or 10 physicians who are the ones taking care of the people that are sick and dying of the flu in this hospital system, the largest in the world. I talked to the doctors yesterday who have been doing the vaccination programs in the clinics and in the schools, and I asked them all the questions that I've been concerned about, like what's the reaction that people have, how many are taking and getting and asking for the vaccine, what are the populations that are receiving it, are there any side effects, and so forth. And I talked to the people that were the physicians who, without any question, no sane human being, if they were to go talk to those physicians, and they can, they're on the websites for the hospital, they're on the websites for the clinics, they're on the websites for the local community centers where these things are going on. These doctors are in private practice. You know, they're primarily pediatricians and internists, and they're not associated with the government. They're practicing private physicians. Go talk to them if somebody doesn't believe what I say, because everything that I know comes from things like what I referred to earlier. Public, New England Journal of Medicine, highly peer-reviewed documents. Materials on the internet, some of which are very, very good. And things that are public, such as what I just referred to. Now, it's going to be a hard job. If somebody doesn't want to believe me, then the only thing they can do is go do what I just said I did, do it themselves. I can't help any more than that.
One of the big concerns that our membership has had and expressed on the site It's kind of, there's kind of two sides to the fence, or two sides to the game. On the one hand, we have a lot of very conspiratorial people who are convinced this is an engineered disease. On the other hand, we have another group who are fairly conspiratorial-minded people who believe this is nothing but a bunch of hype pumped up by the mainstream media. And case in point is the tendency for the mainstream media to throw the word pandemic out there. Pandemic is a very scary word to people like me, to the average person who's not a medical professional and has children, has loved ones and family and friends. Very scary. And the mainstream media tends to throw that word out, but never define it. You know, I've yet to see a newscaster in the mainstream media say this epidemic, pandemic, flu is terrible, and then go on to say, and by the way, the CDC and the WHO define a pandemic as X. Now, in your opinion, does that make sense to you? Do you agree with the mindset that they're really overhyping the word pandemic and failing to define it for the layperson? And is this irresponsible on their part, or is it responsible on their part because we should be scared?
That's a really good question, and my answer may not be as satisfying as I would like it to be, but all I can do is tell the truth, then I never have to remember what I said. It's unconscionable. It's absolutely atrocious. And yes, there has been an incredible miscommunication from the beginning of this by people who initially I thought should know better. And then as things developed and answers didn't come, and there was a pattern that emerged. I don't think it's a pattern that many people that are conspiratorially minded thought about. I developed a different sort of a view. Here's the deal, and you said it right. The words like pandemic and all the other words associated with this are never clearly defined. If you go today to the Centers for Disease Control website, you'll find one of the worst websites in terms of communication to the public that has ever been designed. It's as if the people in the CDC don't even know how to get a proper website developer. And no, there's no, in the frequently asked questions, clear examples to define the words that are the ones that we are absolutely concerned about. I'll give you one example. This is not necessarily picking on the CDC website. It's actually picking on the media more because it's a simple thing. There is probably a total of 1 million hits on the internet on the narrow question of side effects of the vaccine. And the phrase that's used mostly is, have there been any serious side effects? And what we read when we go to the government and people at NIH and doctors for sure in public health venues, including some that I just mentioned I've talked to in the last several days, you might get one of two reactions. And I'll give you an example. I talked to one individual, a physician, one of the most outstanding physicians I know, a lady who was a doctor who takes care of sick kids constantly and is passionate about this, graduate from Harvard, board certified in internal medicine, board certified in pediatrics, responsible for one of the most important vaccination and care program for children in Michigan. And I asked her, I said, have there been any side effects? She said, yes. Yes, there have been. I had any serious side effects? Yes, there's been some serious side effects. I say, oh well, okay. It doesn't say there are any in the media. What do you mean? Well, I've had two. I've had two serious side effects. And what happened was the kids got really woozy and they got kind of faint. And I thought they might pass out. And I thought maybe they were having a reaction from the vaccine, like occurred with a lot of kids up in Canada where a batch was withdrawn. And so I asked her some more what she did. She said, well, I called the state immediately. I called the state and said, are we having any numbers that are scaring you? We've had 2 out of 2,500. Well, no. Then she found out a little later that her 2 that she had that she was concerned about were now 2 out of 25,000 vaccinations. Then I called another doctor. Same sort of a job for the state, asked the same question. His response was, no, we're not having any serious side effects at all. I said, well, I just heard of 2. And he said, well, what were they? I explained. He said, oh, well, that's not what I mean by serious. When I mean serious, and we talk about serious side effects from a vaccine, we're talking about somebody that ends up with Guillain-Barré, or we're talking about somebody that dies from the vaccine, or we're talking about somebody that has an anaphylactic shock reaction and we have to resuscitate, or I'm not talking about somebody that gets woozy. Sure, a doctor out in the clinic thinks that's serious. All right, sorry for my little rant here, but the point of it is, I've reviewed in the last several weeks a lot of websites where there are claims of serious side effects, and they always handle these the same. Total. 50 side effects from Iowa, 50 or 70 or 80 side effects from Canada. The government's lying to us. Well, the government's not lying. The government is just stupidly not defining what a serious side effect is. Now, if you look at the actual numbers of serious side effects for this set of vaccines, and I'm talking about all 5 producers, with the exception of a number of cases that occurred where a batch was pulled because people were getting sorer arms than they should have gotten and were getting fever that were a little more serious than they thought they should be, there's been very few side effects. I can't say there's been none. And I worry about the fact when I hear that somebody who's been a pregnant mother has lost a child or had a miscarriage 2 to 3 days after the vaccination. And I hear cases like that really cause a doctor to be very, very worried. We become very, very worried if we start getting a lot of those. But when the lot of those comes blurred in web pages that give summaries, and then you go down, as I did a couple days ago, I reviewed 50 cases on one of the websites. Mark, of the 50 cases, 25 had absolutely nothing to do with the vaccination. Of the remaining 25, 10 of them were in people who were terribly ill to start with, which is why they were given the vaccine, because they were in danger without it. And yeah, side effects in those cases were serious, but they're a lot less serious than the 1 out of 2,000. 1 out of 2,000 who get the flu, who die, or who get the flu and end up being for 10 days in an ICU and end up having 4 months of recuperation, not because of the vaccine, but because they had the flu. So serious side effects, and some of them are serious, at the rate of what we're now seeing, 48 10,000%, is serious. If you're one of those people that lost a baby and you think it was because you got vaccinated, you bet that's serious. But it's also serious for what is now, depending upon how you do the arithmetic, something between 3,000 to 7,000 people who've died from H1N1. It's not arguable. We could talk, if you want, about why we don't know if it's 5,000 or 6,000 people, and people are using the numbers that are with those wide bandwidths. And there's good reason to do that. But that's a lot of dead people from people getting the flu.
Wow. Okay, Kit. So basically, it makes a lot of sense, on the one hand, that 0.001% of the people may ultimately have a negative reaction to a bad side effect or possibly die from getting the vaccine. That makes sense. Highly recommended thing to do if, 1 in 100 are going to die of the flu who don't get vaccinated. That makes complete sense to me and probably most everybody else that's going to look at it critically and logically. But there's still the issue of Baxter Labs and the World Health Organization. And there's a lot of information out there. There's a lot of it on our site, a lot of it on other sites. There's a lot of it offline. That is pretty undeniable, where people, have found out that there's some contamination, possibly, we haven't got that confirmed yet, in Baxter's vaccines are getting infected with live flu. Now that's a huge concern. And, if there's a conspiracy of conspiracies relative to this disease, there's a lot of thought that, for financial reasons, Baxter could be engineering this flu, or they could be putting it in the vaccines to sell more vaccines, getting way out there. There's conspiracy theories that the World Health Organization, it might be in their best interest to keep their power position and to keep their importance level high, that they're in cahoots with Baxter. So from that perspective, what have you discovered? Is that true? Is it crazy? Is it, even possible?
The Baxter case that you just referred to and the relationship with WHO is an example that actually has been bothering me a lot. And I guess I would say, of all the stories that I have looked at concerning this issue, if I had to make a choice, where did I think there was a possibility that there was information and data for a conspiracy, that would be it. Now, not, I think, probably the conspiracies at the level that you just described, but I think that the data is clear and confusing, and it just rankles the hell out of me, the way this is playing out. But I think it's a conspiracy of silence, and I think it's a conspiracy of stupid people. I don't think it's a conspiracy of anything that is inherently evil. And I can tell you the people that I know in WHO and the people that I know in the intelligentsia of these organizations, including Baxter Pharmaceuticals, first of all, they're not the kind of people that would do something so evil. Secondly, they're not smart enough, in any event, to be able to pull something like this off from the standpoint of a conspiracy that would be evil. Now, are you asking me whether I think that in the boardrooms of Baxter or General Motors or any other large company, how about Google, there aren't discussions about how to handle information to maximize profit? Sure. But when it comes to the issues of engineering something to be able to do something nefarious, there's two sets of reasons why I don't believe that. I'll get back to what I do believe in a minute. One is it's too complicated. Virology and epidemiology and pharmaceutical manufacturing and all of that stuff is more complex scientifically than all the physics and engineering to build a nuclear weapon. It's more complicated in terms of math, in terms of modeling, in terms of the numbers of people that have to be involved, in terms of understanding molecular dynamics, in terms of all kinds of things. And the people that are in those organizations aren't smart enough in any of those individual organizations, nor are they evil enough to be able to do something like this. But here's the part of this Baxter story that bothers me. The story about Baxter's having the problem where there was a contamination of live vaccine material that was H3N2 human and H5N1 virus adding together and then killing the ferrets and all of that. By the way, that's the standard model for doing testing for vaccines, was inexplicable, absolutely, completely miscommunicated. If you look at the data, both sides of this issue are at serious fault. If you go to the Baxter websites, for example, you can't find any evidence to explain how this happened or why it happened, yet there are 35 stories about vaccine purity and contamination that don't relate to this particular incident that we're concerned about. Yet this they have been silent about. That's really silly. It's really silly because at the worst they could say they don't know how it happened. Now, on the other hand, the media hasn't been very good either. If you really look at the data, there's some really good stuff. There's an analyst who's a pretty good analyst, Jane Burgermeister. She's done a lot of work on this. And she actually wrote some pretty good stuff and is trying to dig in. And she's been kind of quiet. She wrote her last real definitive work in April. Hasn't been much since. A little bit of an update in October. October, November, December. That's not a heck of a lot of attention being paid by the media to try to dig out whether some of the things that she asserted, all of which, by the way, are checkable publicly. There hasn't been anybody in the media that's gone to the hard work of checking them out. In fact, if you look on the internet for stories about the Baxter case, they end in the middle of March. The media hasn't been interested in this story since last March. So, of course people are conspiratorially minded. But you know where they better be conspiratorially minded is toward all of the media. I mean, I don't believe for a minute that there's no competent person that is able to address this issue and talk about vaccines. There are a number of journalists out there that are really good at it. So this plagues me. I don't know the answer to the Baxter case. I think it is a conspiracy of stupidity.